I was a distance runner in high school and college, ran cross country and track, and even ran a few marathons. In fact, I held my high school 2-mile record for 25 years back in Michigan. And it only came down when they switched from running miles to running kilometers. So it went from a 2-mile to a 3,000 meters. So my record came off the wall unbroken, which was kind of cool. And a little later in life, I spent the last 30 years working in electronic health records. So please don't hate me. I know what you guys have been through in the last 15 years getting used to that technology. And it has been a tough transition. I mean, we're not really there yet, but we're getting there. It's getting there. But most recently, I would say my most important accomplishment is I'm a quadruple cancer survivor. I have survived melanoma, a week later bladder cancer, prostate cancer, and thyroid cancer, all right here at UC Davis. I've donated quite a few body parts here to UC Davis. But my last PET scan says I'm cancer-free, so thank you, UC Davis, and the good Lord. So back in 2015, I was working here for Dignity Health. Sorry, no. I was working for Dignity Health. I was their manager of acquisition data conversions. They were grabbing practices up as fast as they could get them, anywhere from Reading to Bakersfield. And every time they'd buy a new clinic, I'd take my team in and we would convert all their medical records to electronic format and put it on their EHR. And so it was, it was important work. I was really happy with what I was doing. And I said, I want to get back in shape. I want to run at least one more marathon before I'm too old to do it. So I started running again. I got up to about 4 miles a day and started passing blood. Yeah, that's not good. So I went into my urologist. I said, hey, I think the old guy might be pushing it a little too hard here. So he ran the scope and sent some samples off. Came back a few days later, and I thought, well, he's just going to tell me to slow down. You're pushing it too hard for an old guy. He said, Mr. Evo, I've got some bad news. He said, you have a stage 2 tumor on your bladder wall. You're going to have surgery to remove your bladder and probably your prostate. Boy, that hit pretty hard. He said, now we have a surgeon up here in the area that does these types of procedures. And I didn't even like the way he said that. I said, tell me, doctor, if it were you, where would you send yourself? So my Sutter urologist sent his Dignity Health employee patient to the UC Davis Cancer Center, which I thought was pretty cool. Well, we're just one big happy family anyways, right? It's interesting, because when we left that meeting, Deb said, before he came in the room, all I could hear in my heart was a voice saying, trust me, trust me. Now I know why he was saying that. So a little while later, I met here with Dr. Delera, surgical oncologist and a terrific human being. And he said, all I do is bladders. I said, then you're my new best friend. He said, we can do one of two things. He said, you're going to lose your bladder, probably your prostate. I can just run a conduit out through a catheter and you'll hang a bag off your leg, and that's the way people do it most of the time. Well, my older brother Gordon had done that 15 years earlier, and he was still doing just fine with the bag around his leg. I said, well, okay. Or, Dr. Delera said, I can take a 6-inch section of your lower intestine and build you what we call a neobladder. And it will remain inside, function the way your bladder does now. And I'm a techie. I thought, cool. I want the latest and greatest. And I thought, it's probably going to be tough running a marathon with a bag of pee hanging off my leg. So yeah, let's do that. So on October, I spent 6 weeks going through chemotherapy here at the Cancer Center. Now, personally, I thought I looked pretty sexy bald, but Deb really didn't like the new look. So we grew it back. You realize the curly part has just come back in about the last 3 months. I mean, I had a fro when I was growing up, but the chemo just flattened it. But it's like, hey, your curly hair's back. And on January 13th of 2016, Dr. Dallaire took 6 hours to build me an ileoconduit neobladder with a Studer pouch for males. And I am amazed at what our doctors can do. I mean, I can still pee like a big boy. He came in a day later in my room on Davis 12 and said everything went fine. We were able to do everything we wanted to do. Oh, by the way, this procedure, this radical cystoprostatectomy, has the highest rate of post-op complications and the highest rate of hospital readmissions of any surgery in medicine. And I said, thank you for telling me that. Now? Can I have a redo? Nah, I would have done it anyways. But the complications started immediately. I mean, I had ileus, I developed a urine leak, I had poor oral intake, the Foley's kept getting plugged. They taught Deb how to do the old dual catheter flush, squeeze in this side, drain it on that side, flick it in the other on. She got really good at that. The doctor was watching her do it one morning. He said, you would make an excellent nurse. But I gotta tell you, it was tough. And it was 6 days before I even felt like I had to go to the bathroom. So I tell my nurse Janice, oh, that was good news. She helps me get to the bathroom. When you're done, just flip that little switch there. So I dutifully flip the little switch, and the door swings open, and in steps Janice. And that kind of surprised me. I said, now, what are you doing in here? Well, I'm going to help you. And when I realized what she meant, I got a little squeamish. I said, I've been doing this since right after diapers. I think I can handle it. And she looked me right in the eye. I have to help you. And that was the end of that discussion. Sweet little Filipino with a cast iron backbone, I'll tell you. So while I endured the most humbling, not humiliating, but humbling experience of my adult life, I said, tell me, Janice, when you were dreaming of becoming a nurse, thinking of all the ways you were going to be there for people when they needed you the most, did this ever come to mind? She looked me right in the eye again. I signed up for all of it. And I realized, man, the civilians driving by this hospital have no earthly clue what these nurses are doing up here every day. A couple, 3 days later, I asked another nurse, why did you choose nursing? I didn't choose it. It chose me. And I knew exactly what she meant because I'm a PK, preacher's kid. My dad was a pastor in the Free Methodist Church back in Michigan. 2 of my older brothers, Gordon one of them, were Free Methodist pastors. 2 of my nephews are Free Methodist pastors, and our son is a Nazarene pastor up in Alaska right now. You ask any pastor why they chose it, and they will say the same thing. Are you kidding? I didn't choose this. God called me. And they use the term, it's a calling. And after spending 4 months here under the care of dozens of nurses and therapists and doctors and psychiatrists, I am convinced that you too have been called to do what you do. And whether you believe that's God or not, it's up to you. But something far greater than yourself got a hold of your nurse's heart, and you knew you had to do this. Does that make it easy? Twice while I was growing up, Dad stepped out of the ministry for about a year each time. When I was in 2nd grade, he took a job sitting on a bench and building metal tape measures. When I was in high school, he took a job as an elementary school janitor, drove the school bus. Does that mean he wasn't called? It means he was human, and he needed his spirit of caring reignited, and to care for my mom, who had serious health problems. I sure wish he'd had something like this to help him out. He had to do it on his own. Well, I was discharged after 12 days, but I was not doing good. And Dr. Glass, surgery resident, told Deb, you keep a close eye on him. Maintain a low threshold for readmittance. They were already looking at it before I even went out the door. and I lasted about a week. And I couldn't keep food down, and I was in pain. So she took me back into the ER. Well, for starters, you got right lung pneumonia, that's not helping, but you also have abscesses in your intestines, and we're gonna have to readmit you. So the ED nurse comes in, and he tries to shove a garden hose up my nose. I mean, that NG tube was this big around. Well, it was not, but it sure felt like it. It hurt like the dickens, and I fought him pretty good. He had to bring a buddy in to pin me down while he got that nasty thing down me. I thought, maybe these people aren't my friends after all. Well, they put me back up on Davis 12 for 3 more weeks. They tried to resolve those abscesses. They couldn't get to them. They're in a bad position. They just kept getting worse. They put me on Dilaudid for the pain. Started having sepsis. Things were just going downhill. So we're going to have to go in and do a bowel resection. So they gave me a unit of blood because I was kind of anemic, and they take me in for pre-op, and I start running a fever. So they said, whoa, he's having a transfusion reaction. So they cancel everything and put me back up on the floor. Well, it's not that, it's just more sepsis. So we have to battle out for a few days, but we're finally able to do the bowel resection. And they get that done, and hopefully I'm on my way to recovery. Except when I woke up from that bowel resection surgery, things really got weird. I knew I was in a hospital because I was laying there on a bed with a bunch of other empty beds and had a bunch of tubes coming out of my belly, so something happened, but I could not remember why I was there. It was like, well, was I in a car wreck or what happened? And I laid there for a couple hours before somebody finally came in, and I said, hey, this is probably gonna sound a little weird, but I don't remember why I'm here. Can you tell me what happened? And she just looked at me. I said, no, I mean it. I don't remember why I'm here. What happened? And she just turned and walked away and went about her business. And I thought, well, that's pretty rude. I asked her again, and she wouldn't answer me. Well, my favorite t-shirt is green, has a Celtic symbol on it, and it says, I can't keep calm, I'm Irish. And so I didn't keep calm. And I yelled at her, look, sweetheart, I want to know why I'm here. And this guy comes in the room. And before I can say one word to him, he grabs my forearm with both hands and just grips it tight. And I said, wait a minute, what are you doing? You don't have to get physical with me. I'm just asking why I'm here. And I tried to pull away from him, and he wouldn't let go. And I started to struggle with him a little bit, and 3 more guys come running into the room, and they all started fighting with me. I couldn't believe it. I yelled out, what are you guys doing? All I want to know is why I'm here. And one of them pulls out this pair of white puffy mittens, and they put those things on my hands, and I went crazy. I couldn't grab anything. I couldn't scratch my nose, man. It was an all-out panic attack. I fought those guys with everything I had in me, and they pinned me down, and they strapped me to the bed, and they just all left. And I lay there, my heart just slamming in my chest, and I just cried out, God, what just happened? Who are these people? Why did they do this to me? What's going on, Lord? And I lay there all day. That night, she came back in. All she did was shut the lights out and left. And I lay there all night, scared to death. No idea why I was there or why they were doing this to me. Next morning, she came in, put her face right down by my pillow. Well now, are you going to behave, or are we going to have round 2? And I said, how can you talk like that? How can you be this way? All I'm asking is why I'm here. And Deb came into the room. Never so glad to see that woman in my life. I said, Deb, something's really gone wrong. I'm having short-term memory loss. I don't remember why I'm here or what's going on. And nobody will answer my questions. And she's just trying to calm me down. And I realize she's not going to answer my question either. And I got angry. And I grabbed her arm just the way that guy done to me the day before. She cried out, "Jeff, you're hurting me. Do you want to hurt me?" "Yes, I want to hurt you. You're with them." In comes the goon squad again, and out comes those mittens, and I just threw up my hands. I said, "Look, I won't fight you. I won't fight you. Just please don't put those things on me again." But they did it anyway. And my whole world was gone. Everybody was against me, even my own wife. And I had no idea why. And for the next 4 weeks are the most bizarre of my entire life. They kept moving me to different hospital rooms. I mean, room here, another room over there. A bunch of contractors came in. They were hanging sheetrock in the room. "Isn't this place finished yet? What's going on?" They moved me down to a big old house down in San Francisco. My hospital bed was in a living room. I said, "Why is there a Coke machine in my hospital room?" It was like, what's going on? They put me in the Marriott for a while. That was kind of classy, but I thought, why are they doing that? Now, the coolest rooms of all, you may not have seen these, but they're on the first floor at the hospital, and they've got French doors that open up out onto these nice little patios so that the patient's family can come and visit. I spent quite a few days out there. You may not have seen those. Man, it was weird. And I just couldn't understand what was going on. My sister Betty came for a visit up from Tucson. We had the most wonderful visit that day. My hospital bed was in a lodge up in the Sierras. It was in a finished garage. And we had the most wonderful time. And I still remember her bending over and kissing me and saying she loved me. And that was one of the nicest days of my life. And that's what I remember. Except this is what Betty saw. How does the human mind do that? Well, nurses would come in. They come in one night and they said, "Well, good night, Mr. Evoy, we're going home. We'll see you in the morning." I said, "What do you mean?" "Well, we shut down the unit at 8 o'clock. Well, we'll see you in the morning." I said, "Well, what if I need you tonight? What if something happens?" "Oh, you'll be fine." I thought, what kind of whacked up hospital is this that lets their nurses go home at night? I mean, it was just the stupidest thing in the world, but it was real. Man, I couldn't understand it. But the worst thing in the world, every few days, the nurses would come in and walk me down the street to an old ramshackle house, looked like something out of the Addams Family. And the big old dusty rooms had 4-poster beds, and they would strap me in those beds, and they would torture me. They would shock me, and they would stick me, and they would beat me. I kept crying out, "Why are you doing this to me?" And I wondered, am I in hell? I mean, I thought I was a good Christian, but did I die and miss it? Am I going to be tormented forever? You have no idea what real despair can be when you just think all hope is gone forever. Nighttime was the worst. I hated it when 7 o'clock had come. Deb would leave. I'd leave the TV on all night. I didn't want to wake up to the emptiness, to the quietness. One night my nephew Steve came up from Ripon. He was the pastor down there at the time. "Aunt Debbie, you go home. I'll watch him tonight." She said, "Uncle Jeff, I watched you fight those restraints all night long. And by morning, you had freed your right hand. And I watched you reach over to free your left hand, had my finger on the call button. I had to turn you in. You cried out, 'Steve, how could you do it?' 'Uncle Jeff, I had to. You kept pulling all your tubes out.' So delirium doesn't just hit the delirium patient, it hits everybody. The family suffers too. For a year after I was discharged, I could not get my head around what in the world happened back there. What was all that? So I finally ordered a copy of my medical records. I'm glad I didn't have them printed out. 5,500 pages. 2,500 pages of progress notes. I had 9 different care teams working on this. I was getting 15 notes a day. Took me 4 months to read that stuff. But then I understood what the heck happened back here. I mean, whew. They started me right on PCA. Had a blood clot in my right thigh. They were sweating bullets over that. What do? Do we put him on oral anticoag? Are you kidding? He can't take it. What do we do? Well, they finally stuck a IVC filter in me. He's alert and responsive, but not talking. Is it clinical depression? Is it situational depression? Is it hypoactive delirium? The same note, the same word is in my chart day after day. Confused. Confused. You have no idea what confusion really is. Yeah. Man, no idea. Found lying on the floor, no apparent injuries. Found kneeling on the bed. Tried to get up to go to the bathroom, got all tangled up in his restraining belt. Keeps pulling out his Foley and NGT. So they finally bring in the psych team and say, we gotta know what's going on with this guy. So my first psychiatric evaluation, psych says, I cannot assess this patient. He just stares. Immobilization can prolong and worsen delirium. During my interview, the nurse were attempting to manipulate the patient's tubes. He was resisting them and groaning in pain. What are you supposed to do? Don't restrain him. It prolongs delirium. Okay, then let me just pull all my tubes out and tear the room apart. What are you poor nurses supposed to do? It is a no-win deal. I kept failing swallow tests. So they wanted to bring in the ENT team. Let's just do an endoscopy and see what's going on. I wouldn't even let them put a tongue depressor in my mouth. Fought them tooth and nail. They finally left empty-handed. Couldn't do it. And then I read a note dated 9 days after the ball resection. Has not spoken since the surgery. You gotta be kidding me. I've been yelling at you guys since the minute I woke up. Mumbles incoherently. No wonder nobody was answering my questions. I wasn't saying anything. But I was. They started tube feeds. We got to feed him somehow. And then 4 weeks after, problems started to resolve. Wife reports that he said, good morning. And our granddaughter, Kayla, who was in the 8th grade at the time, was sitting on the windowsill. And I remember her exclaiming, you guys, I can understand Grandpa. And we started the journey back to the land of the living. Problems started to resolve. Interesting on my note. 2 days earlier, he pushed the PCN button 1,400 times. No wonder I was feeling so good. No, I think that's why you put governors on those things, right? I didn't think my thumb could move that fast. So yeah, I was trying, but I was off restraints for hours on end. Pinned me back at night, but I was starting to be free a little bit. It was like, man, maybe there's hope. Every morning at 6:30, I'd have anywhere from 6 to 16 doctors horseshoed around my bed talking about what's going on. I mean, my word, all I kept hearing was, Mr. Evoy, we have some bad news. Mr. Evoy, we have some bad news. I mean, the list just went on. I had the blood clot, multiple sepsis event. I was a marathon runner, but I was having all kinds of heart problems, tachycardia, high blood pressure, arrhythmia. They were struggling to keep my heart going. He has no cardiac history. Where is this all coming from? failed multiple bedside swallow tests, hypernatremia, hyperchloremic acidosis. They finally had to hang a bag off me for my gallbladder. They debated taking it out. They just hung another bag off me. Man, I had more bags hanging off me than kidney damage, stage 3 kidney damage. The sepsis just kept beating up my kidneys bad. Pelvic hematoma, malnutrition. Can't tell you how many notes end with assistance appreciated. But when your doctors are asking for help, you know you're in trouble. And I used to get angry, irritated. They kept talking about putting a permanent feeding tube in me. And every day, well, we're still talking about it. I didn't realize till later they were arguing about it. Urology on one side, GI on the other. They don't tell you that. Finally, one day in the morning, we're still talking about it. And I looked around that bedside with all those very illustrious doctors. And I said, you've been talking about this feeding tube for 17 days now. I said, is there anybody standing around this bed who can actually make a decision? Nobody said a word. They just all turned and filed out. I said, Jeff, you can't talk to these people like that. They're probably out there taking their name off your case. Nobody wants to work with a jerk like you. But that evening, the GI doc came in. He said, today is my last day on your case. I knew it. He said, I'm done with you. Well, he was done because he said, I have reviewed your chart, and we are not going to insert a peg tube. I said, thank you for your decision. You may never eat again normally. Oh, really? I couldn't swallow. But I guess we'll have to deal with that as it comes. What was interesting is every morning when the nurses and doctors would come in, you know what their first question was? It wasn't, how are you doing, Jeff? It was, is your wife here yet? I mean, why are you more in love with my wife than you are the patient? Until I started reading some of the notes and realizing what an incredible help she was to the team. Remember, one of the notes is a very long transcription. The team is in there doing something. I think it probably was a heart issue. They're fighting to save my life. And right in the middle of the dictation, wife is standing at the bedside working hard. Now, why does a doctor acknowledge that? Until I found out what the real reason was. He's much more cooperative when the wife is present. She said, oh, they never would try to change your wound dressing unless I was standing right there. And yet I didn't know what was going on, but somehow I knew. Well, I did, because the night nurse would call Deb and say, he's having an especially hard night tonight. He can sense when you're here. And she'd get out of bed, usually after midnight, drive in here from Elk Grove, and sit beside me. I was hospitalized for 115 days, and she was here 115 days. If you're here, I'm here. Well, problems are resolving. Mike, PT therapist on Davis 12, comes in one morning. Mr. Evoy, the doctors want you to start walking. Well, by that point, I'd lost 44 pounds, and I couldn't even move myself in bed. And I said, Mike, I can't even lift my head off this pillow. How in the world am I supposed to do that? And he looked me right in the eye. You guys are good at that. If you want to get out of here, you're going to have to make the effort. And I realized he was right. He told me later, I can't tell you how many patients I wish had your will to live. I deal with so many who have given up. Well, I thought to myself, Jeff, you're going to have to go back to cross-country camp, and it's going to hurt. You know how a distance runner becomes a better distance runner? They go out every day, and they make it hurt so bad that their legs are on fire, their lungs are burning, and they just want to puke. It's a great sport. Yeah, it's a rare bird that's a long distance runner. And I said, Jeff, you're going to have to make it hurt, but you're not fighting for trophies and medals. You're fighting for your life. And so that afternoon, Janice came in. Mr. Evoy, are you ready to go for a walk? And she had to coach me on how to get out of bed. Okay, we're going to turn on your side, then you're going to bring your elbow up underneath you. You know how to do it. And you're going to push up while you swing your legs down. And it took every ounce of strength I had to stand up behind that walker. And I shuffled to the door, and I stared down that mile-long hallway, and I said, I can't do it. She put her hand on my arm. Let's not go all the way around this time. How about if we just go to right there? And she walked every step of the way with me. And she kept encouraging me. You're looking good, Mr. Evo. You're doing great. You got this. I do not know how I made it, but I got to that point. And I got back, and I fell into bed. And I cried out, God, how did it ever come to this? Am I going to leave here alive, or is this it for me? If I do leave here alive, what am I going to be? A vegetable that my wife has to wheel to the bathroom? I had no idea. And the voice in my head said, trust me. And I just had to let it go and keep walking. Had a new night nurse join the team. Young guy, boy, he was just all cheerful and ambitious. Had to be a rookie. He hadn't been beat up yet, you could tell. Mr. Evoy, I want to walk with you every night. Finally, Mr. Evoy, can I walk with you tomorrow? Sure. So 6 a.m., Junior comes bouncing into my room. Good morning, Mr. Evoy. Are you ready to go for a walk? And I looked at the clock and I thought, man, kid, you need to find yourself a hobby. No, I didn't. I appreciated his spirit. So we took a lap around the track, and you know what? I realized it was as much for him as it was for me. He wasn't satisfied just observing my care. He had to care for me himself, because he has that nurse's heart, and he's gonna be a good one. And one day Janice came in and said, okay, when we came back to the room, how about we sit in a chair? I go, why would we do that? There's a wonderful bed right there. I sat in the chair. It lasted maybe 5 minutes before I fell over. And every few days we'd sit in the chair a little longer. And then I realized I'm sitting next to my wife and we're chatting. And this is what people do when they're just living. She was a pretty wise nurse, getting me introduced to the fact that you're going to live again. You're going to do the nice, simple things like sit in the chair and chat with your wife. Man. Deb came in a little while later. The nurses just told me I can take you outside. Man, I wasn't even dreaming of outside. But they bundled me up like we were going to the North Pole and put me in a wheelchair, and she pushes me to the elevators. Just the two of us, no chaperones. It was our first date in 3 months. And when those hospital doors opened and she wheeled me out under the open sky, I couldn't contain it. It wasn't just that I'd been cooped up for 3 months. I didn't think I'd ever see this again. And to look up at the clouds and hear the birds and feel the wind on my face was unbelievable. And as she wheeled me down the sidewalk, I looked around at what looked like the planet Mars, and I thought, how in the world am I ever going to function out here? I don't remember how to shave. I can't take a shower by myself. How in the world am I ever going to go back to work? I couldn't see any of it. Little voice just said, "Trust me." And I just had to let it all go and keep walking. And a different nurse came in and said, "I want to walk with you today." I was curious as to why he showed up. As we're doing the lap around, he says, "Oh, come here." And he leads me over to where a nurse is sitting at the chair and another nurse is facing the other way. And he leans over the desk and he says, "This is the guy." She looked up at me, the other nurse whirls around and looks at me. "Yeah, this is the guy." And I said, "What in the world are you talking about?" "Oh, man." The call went out on the floor, and when I stepped into your room, I could not believe my eyes. You weren't just standing on your bed, you were surfing it. You'd pulled out all your tubes, you wouldn't let anybody touch you. It took 4 of us guys to hold you down. We couldn't believe how strong you were for an old guy. I said, "Wait a minute. Did you put white puffy mittens on me?" "We had to. You kept pulling all your tubes out." I said, "No, that was just a nightmare." "Are you telling me that really happened?" "It happened more than once." "Hey, do you want to write a journal article about those mittens? There's a school of thought that says maybe they do more harm than good." And I jumped down his throat. "I can't possibly write a journal article about those mittens. If I do, I'm going to demand names. Somebody's got to go to prison for the way I was treated." You know that's in my chart? Think someone should go to prison for the way he was treated. Jeez, oh Pete, you guys, quit documenting everything. We got back to the room, and Deb was sitting there, and I realized I had to know. And so I told her what just happened, and I told her what I did to her in my nightmare. And I asked, "Did that really happen?" "Yes, it did." I asked her to forgive me. I said, "Jeff, there's nothing to forgive. That wasn't you." She knows that, you know that. But how do I deal with that memory? I only remember the 6th psychiatric evaluation I had with Dr. Kahn, chairman of the department. She came into my hospital room and said, "I want to tell you what delirium is." I said, "Why?" "Well, you were in it for 28 days. I said, "Is that what that was?" And after an hour, she said, "I cannot believe how much you remember from within your delirium. Most patients don't remember anything." I said, "Lady, I could write you a book. In fact, we are." There are some memories I would love to not have. But here we are. Well, a little while later, Janice comes in, and I said, "Today, I fly solo. I don't want any help with anything." She stepped back and said, "You're on your own." So I leaned on my side and pushed myself up, got behind that walker and tooled out to the hallway and looked down the hallway, and I said, "I own you." And I started my lap around the track unaccompanied. And as I came to each station, the nurses stood to their feet and applauded and cheered me on. "Way to go, Mr. Evoy. Looking good, Mr. Evoy. You got this." That's when I knew I was going to leave there alive. Didn't know what I was going to be, but I was going to leave there alive. I wanted to shout out, "I love you." And then I thought, see, a creepy old guy wearing a bed sheet, bags hanging all off him, taped all, well, they probably don't want to hear that. So we skipped that part. Occupational therapist came in a couple days later. "Can you dress yourself?" Showed him I could do that. "Can you go to the bathroom by yourself?" I showed him I could do that. "Let's take a walk." Took a lap around the track, and he's watching me drive my walker, seeing if I could stay straight line. Come back in, he said, "You, sir, are ready to go home." And I didn't even know what that felt like. I had forgotten what home even looked like. I just knew how bad I wanted to be there. Well, they had a whole bunch of tubes and bags they had to get off me, so they started with the cholecystitis tube. About 3 days later, got rid of that one, plugged that hole, removed the Foley, plugging all those holes up, really removed all the other bags except the ureters that were to my kidneys that Dr. Dalera put in there, 100 years ago. So he gets me in and taking out the ureters, and I wake up and the nurse comes in, Mr. Evoy, got some bad news. Oh, good, let's hear that again. The surgeon couldn't find those ureters. I said, what do you mean? He's the one who put them in there. He came in a little while later and says, I spent an hour looking for those things. I could not find those ureters. But while I was in there, I went and checked out your neobladder. So that thing's beautiful. I said, leave it to a surgeon to go back in and check out his handiwork, I said, well, I'm glad I got a beautiful neobladder, but what are we going to do about those ureters? Well, we'll get interventional radiology to help us out. So they wheeled in Big Bertha this monster portable x-ray, took a couple pictures, yep, there they are. Now, I have never been foolish enough to pray for patients. I don't know if you ever have, but if you want some, get yourself put on IR surgery schedule as a non-urgent case. And you can watch paint dry by the week, can't you? Oh my goodness. By Friday, I was spitting nails. And Dr. Glass comes in. I said, you drew the short straw, didn't you? Yeah, they can't get to you today either. We'll probably have to do it as an outpatient procedure. I said, you gotta be kidding me. But on Monday morning, nurse comes in, IR says they can get to you right now. I said, then you wheel me down there or I'm running. So they got me in, and they got the ureters out. And I wake up, and I'm looking for my suitcase. Let's get out of here. And Dr. Glass comes in and says, Mr. Evoy, I have some bad news. When we removed them, we could visibly see a pathogen on the tips of those ureters, and we're quite certain it has gotten into your bloodstream. Ah, the old hospital-acquired infection we all know and love so well. I said, I'm not going home anytime soon, am I? We have to know what this is. My oldest brother, Larry, the other pastor, went into the hospital in Grand Rapids, Michigan for a pacemaker implant. How many pacemakers have been implanted in the world? Tens of thousands, hundreds of thousands. And in his case, they also implanted a deadly pathogen. And within 3 days, they knew he was not going to live. And I went up and visited him. And he said, Jeff, there was so much more I wanted to do. I said, Larry, you did everything God ever asked you to do. How many people on this planet can say that? And he was gone in 30 days. So yeah, I know what HAIs are like. Well, guess what? In a matter of hours, I went into septic shock, white cell count through the roof, blood pressure through the floor. They hang 4 bags off me, 3 antibiotics and an antifungal. That's why I got no hearing anymore. And they wheel me down to NICU, and they don't know what it is. Deb authorizes a clinical trial. They're going to try some new techniques to try and figure it out. They come in pulling stuff out of me every day. Took them 5 days to identify it. Candida glabrata, nasty fungus that attacks the eyes and the heart. Ophthalmology team comes in twice. Doesn't look like it affected his eyes, thank goodness, because this one's already blind from glaucoma, so I only got 1 left. But we weren't so lucky about the heart. And the alarms go off. And I've got an internist and a cardiologist in the room trying to save my life and get the heart stabilized. The internist leans over and speaks real softly to me. Mr. Evoy, your heart has just gone into atrial fibrillation. He said, we need to get you back to a normal rate and rhythm just as soon as possible. He leaned over a little while later and said, Mr. Evoy, in the last hour, your heart has run a marathon. I thought, interesting analogy. How'd you know to do that one? I said, well, that's cool. I've run 5 of them, but never while laying in a hospital bed. He leaned over a little while later, and he gave me a little primer on what a heartbeat is. You know, the pulse starts at the base of the heart and goes up along the wall and gets resolved into that was pretty cool. I thought, well, this is kind of neat, being told what a heartbeat is when I don't have one. And I said, I haven't had a pulse for an hour and a half. How come I'm still alive? He says, I do not know. And at the 2-hour mark, he leaned over again and he said, Mr. Evoy, we have done everything we know to do, and we cannot get your heart to restart. And I thanked him. And I closed my eyes and I said, well, Father, I didn't think it would end like this, but you are Lord, and I am okay. You know, Jesus told his disciples to call Almighty God Abba, Father, which is the Hebrew child's term of endearment for daddy. So I just had a heart-to-heart with my dad. I said, look, I want to ask you a favor, but this is not for me, because I'm ready to stand before you. In fact, it was kind of exciting as a Christian to think, I'm about 5 minutes away from seeing heaven. But would you please don't make Deb lose me right now. After all she's been through this past year, it will crush her, and I can't stand the thought of her being alone right now. I trust you, and so does she. And there was nothing left to say. The room was quiet. Internist is standing right there beside me. Cardiologist is at the foot of the bed staring at the EKG. And a very short time later, he looks up. Whoa! Your heart just returned to normal R&R. I said, really? When? Just now. I watched it flip. Now, why in the world did that do that now? I said, sir, you guys are good doctors. But I've got one more on my care team, and he's known as the great physician. And for whatever his reasons, God has decided he's not done with me yet. I was surprised at the scowl on the cardiologist's face. He didn't want to hear that. And I thought, well, someday if you or somebody you love is facing the impossible, I hope you remember the day a patient just whispered a prayer, and God, and only God, restarted his failed heart. I've got a one-liner in my chart. 2-hour RVR AFib self-corrected. I'm sorry, self has no clue how to correct a failed heart. But that's all he could say about it. Internist looks down at me, eyes wide. You had minutes to live. Well, had to recover from that. Wow. Still failing swallow tests, so they put me on a pureed diet. And I witnessed another miracle of modern medicine. They can go out and shovel what the dog leaves in the front yard and make it look like broccoli. I mean, that stuff was nasty. And the poor dietitian, she says, I know. She says, my patients can only stand it for a few days. I said, I can't stand it for a few bites. This stuff is horrible. And I was whining to the ICU nurse. I said, I'd give anything for a glass of cold orange juice. And the next thing I know, he comes back in. Here you go. It's safe. And he had thickened up orange juice somehow. And it was okay to drink. And nothing ever tasted so good. But why do you nurses do stuff like that? That didn't make any difference to my care. In fact, he'd gotten in a little trouble for messing with my diet. But he's got a nurse's heart. And he saw a beat up, worn out old man that hadn't seen a good day in 100. And he wanted to bring me a little sunshine. You know another hero of mine? That stinking NG tube kept getting plugged up. Oh, man. What's the doctor say? Replace it. Oh, I would beg you guys, please don't pull that thing out, put another one in. I hated the... Don't do that. I had a doctor spend an hour one time trying to free that up. You know, he put a wire down it, he'd pour Coca-Cola down and all kinds. He couldn't do it. I thought, we just wasted, that's about $1,000 right there that went down the toilet for a doctor to waste his time with me. Nurses couldn't do it, except for one. There's a Nigerian national on Davis 12 by the name of Demelesh, who is a master plumber with NG tubes. That man has the touch. And he would come in, he'd get that thing freed up. And one time it plugged up at about 7:30 in the morning, and oh no, he just went home from night shift. He won't be back for 12 hours. And all day I kept begging you guys, please, please don't replace it, please don't. Well, Mr. Evoy, it's your food supply too, you know. I said, well, yeah, but I'll starve, we'll make it. In the afternoon I was getting pretty stinking hungry, but you guys had my back. You hid me from the doctors. They never knew it. And that evening, Demelesh comes in and says, man, we're in trouble, Demelesh. This thing's been plugged for 12 hours, probably concrete by now. He laid out a bunch of syringes and the wire and the Coca-Cola and all that. And he fought that tube for 2 hours. And he broke it free. And that young kid started hopping around the room going, I got it working, I got it working. And I ask you again, why do you nurses do stuff like that? That was the hard way. But he also saw a beat up, worn out, defeated old man. And he didn't want me to suffer any more pain than necessary. Do you realize while I was conscious, he rescued me 5 times? I never had an NG tube replacement while I was aware of it. You did a bunch of them while I was fighting you. But he is my hero. And he was in the January class here, and we couldn't stop hugging each other. The physician that kept coming in and working with me on my throat exercises said, if you do ever eat again, it will take months. And those exercises were so weird, man. But they found an acute rehab hospital that specializes in swallow therapy. I didn't know you could get a PhD in swallowing, but I guess you can. Vibra Acute Rehab Hospital up in Folsom. And so they prepared to transfer me up there. And the rep from Vibra was in our room discussing the paperwork, and he said, normally I have one of my nurses handle all the paperwork on these transfers, but UC Davis nurses are the best in the business. I always let them handle everything. So the word's already out. So, 17 days at Vibra. Now there's a depressing hospital. Wow. To see the state of some of those patients makes me say, thank you, God, that I only had what I had. My roommate, it was horrible. But it was a tough enough battle doing those dumb exercises. How do you exercise your throat? Well, you put the ball here and you put your tongue there and you swallow. I mean, it was the weirdest thing. I finally said, I give up. Just stick the peg tube in me. And my son, Jason, the other pastor, flies down to visit me from Anchorage, sits beside my bed, pulls out the list of exercises. Sit up, Dad. Put your tongue to the side of the mouth. I said, wait a minute, what's this? You're not quitting. And he wouldn't let me quit. Sometimes you need a kick in the pants from your own kids to get you over your depression, but he would not let me quit. And so I fought those exercises until one day going out for the barium swallow test, I kept praying, please, God, give me the strength to swallow. And for 30 minutes, that young lady spooned all kinds of stuff down me. And at the end of it, I said, did I pass? And she said, I'm going to look at the recording again. Oh, man. She came in later that afternoon. I do not see anything that disturbs me. Mm-hmm. And they brought me a tray of real food. And I didn't even know what to do with it. I mean, I took 2 bites and it's like, oh, how do you do this? I had forgotten how to eat, and I couldn't put it down. And it was tough every day. 1 or 2 bites, swallow here. How do you do this? Well, they were weighing my tray before they brought it to me, and I wasn't getting out of there until I passed the test. You just got to know how to cheat. I'm glad they never looked in the commode. Yeah, I cheated. I got out of there and I paid for it. I wasn't ready, but I got out of there. And they told me when I left, your biggest risk is you will not eat enough, you will be malnourished, and you will be right back in here. And I swore I'll do anything short of murder to not get back in here. We got home, and it was a struggle. What a brutal recovery. I asked Dr. Delara, what is my recovery going to be like? He said, I have no frame of reference. I've never seen anyone go through as much as you have and live, but it will take years. Had 4 doctors, him, my oncologist, my PCP, and his supervising physician at different times told me, you are a miracle. You should not be alive. And by the first evening at home, blood pressure was dropping. I was back in the ambulance, going back to the hospital, begging Deb, please don't readmit me, don't readmit me. Well, totally dehydrated, not eating, not drinking, couldn't put it down. Our son-in-law was a kinesiology major and was currently a coach at one of the gyms here, and he went to Walmart and he got a big bottle of muscle milk and protein powder and chocolate syrup and whole milk, and I'm going to make you a protein shake that'll knock your socks off. And I lived on one in the morning and one in the afternoon for 6 weeks, and it kept me alive. Man. And at 6-week mark, I put down an entire McDonald's filet of fish and 2 French fries, and we were on our way. Poor Deb, everything she would cook, I'd eat 2 bites and I couldn't. We had so many leftovers. You couldn't believe the leftovers we had because I couldn't eat anything. So we finally got rid of those. I was off work for 11 months, lost my job at Dignity. I said, you can't keep. HR girl was crying, we had to repost your position. I said, you can't have a manager position open for a year. You gotta do it. A year later, I got an email from Edna, one of the nurses on Davis 12. Every so often, we invite one of our patients to come back and visit the staff for a lunchtime meeting. Would you and your wife like to come back and visit us? I said, you gotta be kidding me. You wanna see me again? I thought you'd have an armed guard at the door saying, don't let that guy back in here. But no, Deb and I and Kayla, our granddaughter, went up to visit the staff. And when those elevator doors opened, it was not easy stepping out into that hallway because the demons were all there. Not the nurses. I'm talking the demons. All the nightmares, the hallucinations, they were all there. But the nurses came up and started hugging us. Oh, it's so good to see you. You're looking so good. Are you kidding? Skinny as a ram. You're looking so good. I said, I got to see one nurse. Finally, somebody said, oh, here comes Janice. She came up, our eyes met. We hugged. All we could do was cry. Neither one of us could get a word out. Just too much there. Finally, after a long time, she just looked up at me and shrugged her shoulders and went back on the floor. 2 more times she came into the meeting and we tried, we hugged, and all we could do was cry. That girl went through hell with me. And she never hesitated to step into that room not knowing what she was going to get hit with. None of the nurses did, and none of them gave up on me, even when I wanted to give up. And they never said one word about the delirium. I was speaking to the executives, and the CNO was there, and he said, you know, and this is several years ago, so let's give him credit for that, for the situation back then. That tells me how professional we really are. Well, I think he's changed his mind, realizing we do need to tell the patients what's going on with delirium. But at that point in time, we had no idea what we had gone through. No one ever told Deb one word about it. She's looking at me wondering, what's going on with him? Will he ever be mine again? What will he be again? She didn't know. Just at the World Delirium Conference last week, education, understanding, recognition. We've got a long way to go. I sure wish Deb had had the resources then that you do now here. UC Davis has made a lot of progress in understanding and recognizing what's going on with delirium. Meeting you had, would you like to come and speak at our Spirit of Caring class? I gotta tell you, that first one was tough. It was not easy to remember all that. At the end of it, the facilitator said, you need to go home and lay down. You're beat. I said, I had no idea how tough it was going to be to remember all this. But that's okay. I didn't even mention the delirium for like a year. I finally told Teresa, I said, you know what? I'm going to share my nightmare and see how long it takes the nurses to figure out it's delirium. Let's just play a little game here. So I start to share the nightmare, and I'm talking about the white puffy mittens, and somebody in the back of the room starts weeping. Not just crying, but deep sobs, just weep. Everybody heard her. And I thought, do I need to stop and see if she's okay? But I didn't want to embarrass her, so I just finished the whole talk. And at the end of it, you could hear a pin drop. And then that young lady stood up. I was your night nurse. When you started speaking, I couldn't believe it was you. Just look at you. Can I give you a hug? It was Razil. And so we came and hugged in the middle of the room. She said, you probably don't even remember me. You were so bad. But I cared for you when you were at your worst. I said, it was bad, wasn't it? Oh, it was bad. And she shared a couple more things that they'd had to go through. And then she turned and she kind of teared up. I was one of them who put the white mittens on you. We had to do it. You kept pulling all your tubes out. I said, I know you had to do it. And thank you for doing the really hard job. And she turned to the whole group and she said, it was all worth it. Well, I can sure thank you for that. It was all worth it. Well, I hired on at UC Davis 4.5 years ago now, working on the UC Health Data Warehouse. I didn't think I'd ever have a clear head again. I'm doing the most exciting work I've done in my whole career in EHR. Incredible stuff. Just loving all of it. I didn't think I'd even be able to think clearly. I can take a shower now, by the way. But I've been amazed at the response of some of the nurses from this. This is probably talk number 40, plus or minus. So I'm walking in the hospital, nurse broke away from a group. You spoke at Spirit of Caring last year. I said, yeah, how was that? I was ready to quit, but I'm still here. I said, good, because we need you. One of the nurses looked up at me after my very first talk. I've been a nurse for 30 years, and you just totally changed the way I see the patient. What did I say? What was different? Came out of the auditorium when we were over in the Mind Institute. The nurse had already left. She was leaning up against the wall, just crying her eyes out. She came up and hugged me. Thank you, sir, for coming here today and making me remember why I do this. I said, had you forgotten? Oh yeah, I had forgotten. UC Davis has changed some of the ways they treat delirium patients. And one of the students spoke up and said, I'm in this class because I am so burned out dealing with delirium patients. And for you to come here today and thank me for what we had to do to you, it makes a difference. Turns out she's the supervisor for all the ICU pharmacists. Would you come and speak to the pharmacy team? So I did there too. They have changed the way they medicate patients based on this story. I really don't know everything you've gone through the last couple of years, other than it's been horrendous. I want to thank you for still being here as a nurse. There's a songwriter who wrote a song by the name of Ray Boltz. He wrote a song about what he thought it would be like to watch one of his friends enter heaven. I think the friend's a nurse. And so he's writing the song, and in the verse it talks about people coming up to this girl as she walks through the gates of heaven and saying, "You were there for me. You don't even remember, but you were there for me. You were there for me." And he said, one by one they came, far as the eye could see, each one somehow touched by your generosity. Little things you did, sacrifices made, unnoticed down on earth, in heaven now proclaimed. Now I know up in heaven you're not supposed to cry, but I do believe I saw a tear in your eye as Jesus took your hand and you stood before the Lord. He said, "My child, look about you. Great is your reward." Thank you for giving to the Lord. Realize Jesus said, "Every one of these, my little children that you care for, you're doing it to me." So remember who the patient really is in the big picture. I can't thank you enough for bringing me back to Deb, for bringing my mind back. Yeah, the nightmares are still there. They're not, I know what they are. They're going away. They'll go away. Pretty nasty for a while. That's why other delirium patients have said, "Don't ever ask me to do this again." I am glad to do this. It's a price worth paying to come in here and say thank you to you for what you do, for what you've done for everybody.